Unexplored territory.
Hello. Thank you very much for giving me this opportunity, and I will be talking about this relatively less discussed topic. So, from where this question came into my mind, when some of my patients of cataract surgery, after putting a monofocal lens, were able to read distance and near alike. So when I asked this question to the audience, am I the only person who is seeing this phenomena? Am I the only person who is observing this phenomena? Then many people from the audience said, no, they are also seeing. And that's how I started looking into the project of pseudo-accommodation. So, before going into to understand pseudo-accommodation, let's have a look on the mechanisms of accommodation. So basically in accommodation there are three components. He is trying to show this is convergence. That's part number one.
Diplopia, or double vision, occurs.
Now you can listen what is there.
Second, the pupil must constrict to restrict the entry of light rays diverging from a near object, since diverging rays cannot be bent enough by the periphery of the lens to make them fall on the fovea. If the pupil were to remain dilated, the image would be blurred.
So that's the second component of accommodation.
Finally, the shape of the lens must change, increasing its refractive index so that the light rays passing through it converge on the fovea. In distance vision, the lens is pulled at its equator by the suspensory ligament, so that it is relatively thin. When the muscles of the ciliary body contract, the tension on the suspensory ligament decreases, and this allows the lens to assume a rounder shape, increasing its power to bend light. As a result, the image is focused on the fovea. Combined convergence, pupillary constriction, and rounding up of the lens all function to keep an object in focus as it approaches the eye.
So basically these are the three parts which we have seen.
As an object approaches, both eyes track it in a process called...
So these are the three things which we have seen which make accommodation. So there is a major component in accommodation which is alteration in the shape of lens, and there is a minor component which is anterior-posterior movement of the lens iris diaphragm. Now when we are talking about presbyopia, we know that it is the eye condition in which, while corrected for distance due to age-related factors, the affected persons are unable to read. But when we talk about pseudo-accommodation and depth of focus, what the patient wants to do is read, and they do not really necessarily care if they are accommodating or not. So seeing near is different and accommodation is different. So pseudo-accommodation is guided by two things. One is depth of focus, another is depth of field. Depth of focus means focus is not a point but a line, and depth of field is that it's not a plane but actually a volume. This is a nice video which shows what is astigmatism with the rule and what is astigmatism against the
curvature.
rule. So
Conversely, an eye that has astigmatism would be shaped more like this.
So this is
a steeper curvature in the vertical meridian,
yeah,
and a flatter curvature in the horizontal meridian.
So this single description was very, very explanatory of what is astigmatism with the rule and astigmatism against the rule. So in accommodation, there is a dynamic combination of, so accommodation means it's a dynamic combination of convergence, pupillary constriction, alteration in lens shape, and anterior-posterior lens movement. Whereas pseudo-accommodation has a static component and it has a dynamic component. Static component comprises of astigmatism, asphericity, color transmission, and dynamic component comprises of pupillary constriction and the anterior-posterior lens movement. There are certain positive correlations and there are certain negative correlations. So higher the visual acuity, lower the pupillary diameter, and the important thing is that the asphericity and yellow IOLs show lower pseudo-accommodation. Against the rule offers better near visual acuity, and if there is a minus 1.5 diopter of astigmatism, it shows better pseudo-accommodation. A more important thing that we saw in accommodation, the ciliary body muscles retain the ability to contract even after presbyopic age, and this contractility increases after the cataract surgery. So it has been calculated that this phenomena works more in hypermetropic eye. So how could my patients had good vision for distance and simultaneous near vision? Was because they retained ciliary muscle contraction capability, they have good pupillary constriction, and they had residual astigmatism. And all this is described as pseudo-accommodation. So,
sir, we are behind.
I think that's it. This is my last slide. So, distant vision is surprisingly, this phenomena is very commonly seen and it doesn't fade away with time. And if you also find out that your monofocal patients are able to see distance and near alike, you are free to give me a feedback. Thank you very much.
Thank you, sir. We are slightly behind schedule, so can